Hello there, I'm Tina. I'm from Stan's Pals, the animal care company that likes to share our love with all the animals we meet and work with on a daily basis. So what I want to talk to you about today is our doggy dental clinic. In particular to tell you about the initial consultations that we do there. An initial consultation is where you bring your dog to see us for the first time and we're looking at what is needed. Let me just show you. In an ideal world, your dog's teeth will be looking like this. In our doggy dental clinic, they can be in all different states and sometimes they're as bad as this. We can help when they're as bad as this, but we prefer to help when they're nearer to this and stop them getting that bad in the first place. You don't have to wait until your dog's teeth are completely covered in tartar or really stained and their breath stinky to come for help. You can come quite early on. So, talking about the initial assessment, the initial consultation. So what you do, you book your appointment and your dog will come in for about half an hour, come out the back with us into one of the groom rooms. They'll be on the table, the groom table, which of course for a lot of dogs is a very familiar place, but for those that don't get groomed is a little bit weird. So the first thing we'll be doing when we come out here is getting to know your dog, making a fuss of them, making friends, because we're going to be putting our hands in their mouth with no sedative. So they need to know us and know that we're not totally weird. It does scare some of them to start with until they realise that you're being kind. So the first thing, get to know the dog. Then we'll be looking in their mouth and having a good look round all their teeth, checking, looking at their canines, seeing if they're not broken or damaged and what staining they've got. The canines, the big ones at the front, they're the ones that usually have the worst staining. But we also want to look at the ones at the back because they're the ones that require the most work to remove the staining. So we'll have a good look around and a little bit of a poke and a feel. We want to see if they're moving a lot, if they've got any holes, if there's any signs of decay or anything like that, or if there's anything in their mouth that should be a cause for concern. Very occasionally we see things where there is a big problem and then we're not vets, we can't decide what is and isn't totally a big problem, but we're used to seeing what should and should happen. So if we see something that we think is a cause for concern, the first thing we'll do is say, can you nip to the vets and just go and get that checked out just to make sure. But assuming everything's okay, we will then give them our first ultrasound treatment. We do that using this. This is a cleaning teeth toothbrush. It's the top of the range ultrasound treatment system and costs about £240. The toothpaste that we use with it is £10 a tube. So this is not cheap kit to play with. Our team have had a lot of training and they will be starting off using this and just gently applying it to each tooth. So you can have it so it makes a noise, you hear that? But what we usually do is have it like that. The light's on, the ultrasound's working, but there's no sound. And we put that onto each tooth. That kills the bacteria under the gum line and starts to remove tartar. In the very first session, we might not get to remove any at all, but we will have killed some bacteria and we'll have started to loosen it. Often we do manage to remove quite a bit. These show second session for this one and first session for this one. That is nowhere near as bad as it looks. It came off to that in one session. So we've done a full assessment, we've decided we can carry on with treatment, we'll come up with an action plan and that usually involves ultrasound treatment. Sometimes we use different bits of kit. This is a more shaped and angled brush for really small teeth. We also use finger teeth brushes like this and we advise you use those at home. We use teeth cleaning gel and we also like to finish with a coconut oil scrub because it makes them all nice and shiny so as they end up looking like Belle's teeth on here. Okay. So having done all of that, we spent about half an hour getting to know your dog, doing a full assessment of their mouth and doing their initial ultrasound treatment. We will then be putting together an action plan. So we'll come out bring you back your dog, and we want to talk to you about what the action plan is going forward. And that could involve all sorts of things. There might be some gel we want you to use at home, some water additive we want you to use at home. We might want you to give your dog Fragaria, which loosens tartar, and then bring back for some sessions to carry on the work that we started on that initial consultation. Or it might be that your dog had quite good teeth and we've got them to pristine condition, and then we have a plan for how to keep them like that for the rest of their lives. So it might be in the initial consultation we've got rid of any staining, we've killed bacteria. You then do some work at home in between with gels and finger toothbrushes, and come back in 6 months and have another session of ultrasound, which will then keep their mouth really clean and healthy. That initial consultation is £35. It often takes 2 members of staff to do it. It takes about half an hour, and sets your dog right on the road to healthy teeth for the rest of their lives. If you bring your dog under 2, it's only £25, because that's our gift to you to try and encourage owners to bring their dogs when their teeth still look like this, so we can keep them looking like this. So have a chat with the team, have a look on our website, come and have a look through some of the books that we've got that show you the progress we can make, and let's get the teeth of the dogs in squad healthier. Thanks for looking. Bye.